Welcome to the Mississippi Alliance's weekly webinar. We are happy to have you all here today. We have a wonderful set of presentations ahead of us, and so we're going to have a nice time. My name is Dave Miller. I am the program director here, and I use he, him, his pronouns. And as we always do, we start off with a little bit of remembrance. We are working hard to try and tackle the coronavirus, and we're struggling with that right now. So please make sure that you have your masks. I am happy to see that many retailers are starting to require it. So that is encouraging. If you happen to own a store, I might recommend that you actually have a spot outside where you can actually purchase masks, because I am finding that people can't get into the store to buy the masks that they are required to in fact wear when they are sold inside the store. So interesting little situation, but nonetheless, have your masks, wear them please, for our sake, for your sake, for your family's sake. But we are happy that you're here and safe and well, and we hope that your family is. And so with that, we're going to go ahead and take our moment of silence to remember those who we have lost. Okay, so with that, we're going to go ahead and pivot to some happier news. And I'm going to lead off by introducing Donna Marcum. She is one of our amazing, incredible trainers. And you too can have the opportunity to hang out with Donna tomorrow. I'm sorry, not tomorrow. Yes, tomorrow. No, not tomorrow. What am I saying? Next week.
Monday.
On Monday. Wow. This is what happens when you send out registration reminders for today's training, is that your brain gets stuck on that. So Donna will be presenting on Monday next week. So I'm going to turn it over and let her be the salesperson so that you don't have to hear me do it again. So Donna, the floor is yours.
All right. Good morning, everyone. Yes, I am a certified public accountant. I have been self-employed for about 23 years, and the first thing I have to tell everyone is I don't do taxes and I don't do audits. So everybody always wonders, well, what do you do? And usually there are two paths when you leave college with an accounting degree. You go to a CPA firm and you do taxes and audits, or you go into industry. And I went into a specific industry for about 15 years. And when I pivoted from that to open my own practice, I knew that I wanted to focus on helping small businesses manage their daily operations. Sure, they can cut their checks and make their deposits, but they don't know how to do some things correctly. And so that is what I have focused on for 23 years. I have about half of my practice now or more is nonprofit organizations. I love my nonprofits. I have some other retail and medical groups, but my nonprofits are where my heart and my passion is. And I do try to help them with procedures and doing things the right way, because I think in the last 10 years or so, we have all seen there are definitely right ways to do things and there's the wrong way. And we never want our name in the paper for anything other than a really, really good reason. So usually in a nonprofit, it's a luxury to have a dedicated staff person for accounting and administrative functions. So what we're going to do Monday at 1 o'clock is we are going to present a webinar entitled Dealing with Regulations That Impact Your Nonprofit. And we'll be covering some of the most common agencies that you need to know about and some very practical tips for doing so. We will also cover some of my favorite questions that I get asked at times. The number one is, when is a nonprofit exempt from sales tax? The answer might surprise you. Also, how often should your bylaws be reviewed? And if you don't know what your bylaws are, then you definitely need to be there Monday. Another common question is, who is responsible if the payroll taxes don't get paid? And one of my favorite ones is, how do I know if someone is an employee or an independent consultant, and where do I go to help me decide that? There is a place to go, and it's fairly black and white, even though some people would like to make that a gray area. It's pretty standard out there on what you need to do. And then one of my real favorite ones is, most nonprofits are going to have to file some version of a Form 990. And instead of looking at it like the bear that it has become with all the different schedules, how can you make that 990 work for you and be a messenger for your organization rather than just the 20-page questions that you have to answer for your auditor in order to get that form filled? So join us Monday at 1 o'clock, and I hope to see you there, and have a good weekend.
Thank you, Donna. I really appreciate that. And, you know, I think while it may not always be the sexiest content, is the things that keeps the doors open and people with money in their bank accounts, and making sure that we can continue to serve the communities that we serve. So definitely consider joining. You can register on our website. And as a reminder, one training 25, 2 for 40, 3 is $15 only a piece. And there is definitely still time to register. And on that note, I'm going to again highlight our upcoming trainings. So here we go. You can't see this. Let's try it this way. Aha. Okay, so we have one more. We have one today, the 6 jobs of every board member. There are still seats available. Tomorrow, you remember Pam, she spoke last week about sharing the crayons part 1, appreciating diversity. Tomorrow is part 2, activating diversity. On Monday, you see managing regulations with Donna. Definitely take some time and attend. And then we have some other great ones coming up shortly after that. So definitely make some time and join us for some incredible presentations and training. And as I always would like to remind you, this isn't necessarily just about whether or not you know this information. Look within your organization. Think about building the capacity of your team members. Are there individuals within your organization who can help you, who want to learn, who want to grow? This is a great way to provide them with meaningful opportunities so that they can improve their own skill sets. So think about those in your orbit, people in your office or people that you may have contact with who might find value in these. So with that, I'm going to turn it over. We have the pleasure of being joined by Cathy Grace. She is the co-director of the Graduate Center for the Study of Early Learning, and she is going to be speaking on the impact of COVID-19 in education, but really looking at it from the data perspective and next steps. And so we're going to have a really great discussion on that. So Cathy, thank you for being here. Welcome. And I believe you're going to be sharing some slides, so I will give you that ability to share. But welcome, and the floor is yours.
Thank you very much, and I hope everybody can hear me. I'm on my phone, and hi. And I was gonna ask, Dave, is it possible for you to put up my slides? So since I've got phone in one hand and computer in the other. Would you be able to do that?
Yeah, not a problem. Not a problem.
Okay. Well, while you're rolling that up, I would just like to say that my conversation today with you will be a little brief. I'm going to do another webinar and start the second part of a 4-part training with 200 pre-K teachers through the state collaborative programs. The funding is still, as you know, in question in terms of what was originally appropriated, but everything is on hold until the governor can decide or sign the education bill. But they will still be operational this next year for sure. The question was whether or not there would be additional funds for those collaboratives to help offset some of the local costs. But today we're going to have another conversation, and I'm sure that most everybody has had conversations 3/4 of their day around COVID-19 and the impact it has either personally or on businesses, on families. Well, of course, what I'm going to bring to you today is some information that's very sobering from an early childhood perspective. And this presentation is really about the crisis that we're facing in early childhood. It's not something that is unique to Mississippi by any means, but since this is where we live and this is where it's going to impact us personally, I want to bring some information to you from a data standpoint, and then have a little bit of time perhaps for some response or discussion as to, so what do we do? So many of these issues that are being brought forth are questions that don't seem to have answers. Well, some of the things that I'm going to talk about today, believe it or not, have some rather simplistic answers. That doesn't mean that they're easy. It just means that they're pretty straightforward. So if you'll run the next slide, I appreciate it, Dave. I did not do this for a dramatic impact. This is really true. Our child care centers across the United States are in crisis, and it's projected by some that by the time we are work through COVID, there will only be 40% of child care facilities left in this country if we don't do something to mitigate the economic disasters that they're facing, along with some others. However, people don't realize that childcare is really a backbone industry. These folks that are working in childcare are essential employees, because if the parents cannot go to work, even if the businesses are open, because they can't work because they don't have childcare, then that's going to be a very unstable workforce. If they're leaving their children in unsafe places, then there's going to be a real problem with child abuse, child neglect, some terrible things that could be happening to children, not to mention the educational gap will grow between those that have means, those that don't, and so we'll have a continuing gap in educational progress among our children. Now, the National Association for the Education of Young Children did a national survey where they had 5,000 respondents, and 2 out of 5 across the country, and half of those were minority-owned businesses, are certain that they're going to close permanently without additional public assistance. And this is coming in through the CARE Act that they funded earlier. They funded some funds for child care, but not nearly enough. And there's another bill coming up next week in Washington. The Senate is going to try to get another CARES bill passed for lots of things, not just early care, but hopefully they will have more money that will be sent to the Department of Human Services, in our case, that would be passed along to some child care facilities who are receiving the certificates for low-income child care. So in other words, children who are of low income receive some support so their parents can work. For those centers who do not take those certificates, they are not going to get the funds necessarily in the same amount as those who do take the children that are low income. Nationally, 18% of child care centers and 9% of family child care are closed. And of those that are open, 86% were serving fewer children than they were prior to the pandemic. And on average, their enrollment is down 67%. Now, I presented this information to you to get things in context as far as where the country stands based on 5,000 respondents, which is not a very large number, to be honest, when you're looking at across the country. But now if we go to the next slide, let's see what we've got here in Mississippi. Now, the Graduate Center and the Center for Evaluation Research at Ole Miss surveyed child care centers in May, and there were 35% of those centers responding in our state. This is just our state, which is, for surveys, that's a high response. And so this is just the state of Mississippi. As of May the 11th, 55% said they were closed or operating on a limited basis. Yesterday, when I checked, we're now at 50%. So 50% of our centers right now are closed or on a limited basis. 42% have lost at least half of their revenue. And this was back in May. 51% can't even pay half of their monthly expenses. 72% cannot pay their monthly expenses at all. And so when you look at this from an economic standpoint, COVID has contributed to a loss of nearly $31 million in economic impact throughout the state from the child care industry, because that includes the loss of revenue to the community, purchasing power, and employee compensation. So that's how all that is figured. But now this was as of May. We're now moving into the middle of July. And as you can see, the number of child care facilities that were open in May have dropped. And this is important from a standpoint of if school's about to start, which it seems that they're still going to start school, then where will children be placed if they've been during the summer, if they've been at home with their older brother or sister doing babysitting or playing or whatever while mom and dad worked, and now the children are back in school? What do we do when in some school districts there's going to be a ABAB schedule, as they call it, which means that children would go Monday and Wednesday. They would not go Tuesday and Thursday. Tuesday and Thursday would be another group of children. So they cut the school in half and say half the school's going to go Monday and Wednesday. The other half's going to go Tuesday and Thursday. So where will the children go when they're not in school? Again, child care centers in the past have served the purpose for after school care, but now they may be asked by parents to take their children on all day long. That is a huge change in what child care world is usually like. But again, if they're not open in a community, that won't be an option. And right now we've got some counties where there is absolutely no child care open, and we've got a couple of counties where there may be one or two open. And so what we've got to realize at this point in time that there are several things that are going to have to happen in communities for us to hope that we can create a safe environment that parents will come to understand is indeed safe, because I understand their concern, their fear about putting their children in a child care facility, just like I understand their concerns about putting their children in school. But as long as industry is operating, expecting people to come to work, then people who have to work are in somewhat of a between a rock and a hard place. All right, the next slide. All right, now if we look at the general data picture of Mississippi families, 44% of our children live in one-parent families. 23% live in high poverty areas. 33% live in homes where parents lack secure employment. 27% live in households where the income is below $24,000, $24,300 for a family of 2 adults and 2 children. And 70% of the children under 6 have a parent in the workforce. So as you can see, we are fairly dependent when I say we, families in Mississippi are fairly dependent on having a care system outside of the home, since so many of them work. Now, I spent about 3 years on the coast with child care centers and folks in the business community trying to help child care centers recover when we had Katrina hit, and it was about a 3-year process. But one of the things that really spoke to the businesses at that time was when school teachers said, well, you've got the schools ready to come back, but I don't have child care. You haven't spent that much time developing a plan for the recovery of child care. Well, that's when it started to come home to business and industry that, hey, we depend on schools for the children to be in school while the parents are working, not even thinking about children under school age. So this is going to be, as I heard yesterday, the head of the World Health Organization talk about the fact that with children going back to school, it's not an isolated thing. Children going back to child care, it's not an isolated thing. It's a community-wide determination that the community is going to make it as safe as it can for all families to venture out in any particular activity or event that they want to do. So one of the things that I would like, if we have some time for discussion, to either talk or chat or whichever, is to look at, are you aware of your own community's circumstances in terms of the number of child care facilities that are open or partially open? Have you, the school districts, are they in communication with the child care? I've been working with child care directors. I've been working with some school districts, and everybody is so overwhelmed. But I'm trying to get folks to see that they need to speak to each other and develop some kind of plan for the children who will be going into child care that maybe are second graders, fourth graders. Who's going to be there to help them with their homework? Is the school going to provide an assistant to go to the child care if there's 20 children over there that are between second and fourth grade? What is the plan to keep the educational process working when they're not within the actual confines of the school building? Another question I'd like to raise is in terms of the expenses that child care facilities are incurring. And I would say to you that the PPE and the cleaning supplies are some of the biggest expenses that they have had to add to their already, I would say, fragile budgets. And if you're in a position to work with child care facilities in your community about the types of supplies they need, they can't leave their business during the middle of the day to go to Walmart or to go to Dollar General or wherever to get some things. And then by the time they're able to go at 9 o'clock at night, the shelves are bare. So is there a process within what your sphere of interest or authority or your communication circle, have you begun or even thought about how you could provide some real help in the form of Lysol, cleaning wipes, anything that they could tell you that they're in the need of? Another question that I would raise would be, with the the payroll protection plan and some of these other applications that needed to be filled out, many of our small providers they don't know how. They do not know how to fill out the applications. They don't know the paperwork that they need to have in order to file for some of these applications. Could you offer some assistance to help them with the paperwork, even with the grants for the $2,000 grants and then the up to $25,000 that the state is offering? We don't have a lot of small providers that are making applications because they just feel overwhelmed. This is not their expertise. And so any way that you could possibly help at the community level, I think that would be very much appreciated. Well, I'm going to stop talking here for a minute and see if y'all have any questions or comments to any of the information I have explained.
Sammy's writing me something. Since child care is critical for workforce stability, are child care centers and family daycare part of the enormous amount of funding being made available for workforce issue? MDA has $300 million plus, and there'll be lots more in the next stimulus bill. So are child care providers included? Child care providers are getting a separate CARES package, and it goes to the Department of Human Services, and they got $47 million this first time. It's separate from the $300 million. The $47 million primarily is going to help with the certificate children, I call certificate children, the children of low income who are eligible for getting the, are eligible for getting those funds for child care. They are going to try to reimburse the child care providers for at least a quarter of an additional amount per child. So in other words, instead of giving them what they were before, they're going to get a quarter more. But we have children in child care centers, and we have child care centers that do not get subsidies. So we've got a dichotomy of the ones who are not receiving subsidies, child care centers, and those who do. Now, it's up to the child care center if they choose to get the subsidy. It's not something that somebody keeps from them. It's their choice if they choose to. So that amount of money that is already at DHS is being used to increase the amount of money per child care certificate when the child goes. And that is going to kick in August the 1st. Since March through the end of July, DHS has been paying child care providers to keep them in business even if they weren't open, if that makes any sense. They've been paying the certificates to the provider. If they had 5 children on a certificate, they got 5 times whatever the amount was. And that allowed them to pay the rent, keep the utilities on, do whatever minor work that had to be done to keep the center operating, even though the parents or the situation at that time did not require them to be on site. As of August, that's going to cease. If you're not serving children daily, then you will not receive that funding. Now, they also have used that money for what they call the CARES programs, those programs that serve the children of first responders. Some of you may have children in your communities that are the people who have been in the hospitals, who have been in the police force that are first responders. So I think what I'm trying to say is some of those funds have been in special situations where children are in care because the parents are first responders. Ms. Jones, I'm sorry. I didn't mean to be insensitive about that. They are children, or the families are the recipients of the certificate. So I'm sorry for my misspeaking. The leadership coming from elected officials. Well, we have the Department of Health is responsible for licensing, and we are still trying to get some guidance from them that is more in the field of I guess you could say regulations, the regulations that are coming right now is only in the form of recommendations from CDC. Our Mississippi Department of Health has not qualified or given any direct guidance to child care around anything they must do, such as screen the children when they come into the building, or make sure that the parents are filling out forms so that they can be sure that they haven't been exposed to COVID. There's been nothing about any requirements that are different from what they had before COVID. There are some instances where people have done things on their own to try to make sure that the environment is safe and is meeting all the CDC regulations as possible, but that is of their own choosing. The Department of Health has not done anything yet. So if you were going to look at state leadership, the only state agency that would have anything specifically that addresses the child care industry, it would be the Department of Health.
Okay, it's amazing, Cathy. Let's go ahead and do a final call for last comments or questions. We have room for about one, maybe two more. Feel free to enter them into the chat, or you can turn on your mic. Okay.
Dave, I have a question for Cathy.
Yeah.
Hi, Ellen.
Hey, Cathy. You mentioned that, there is a need, for volunteers or for donations, to help child care centers with PPE and possibly, purchasing supplies. Is there anyone that you know of who's like organizing that or being like a central go-to that could help, organize something like that for centers?
Well, the Early Childhood Academy coaches and the Early Childhood Academies that are at the they're housed at the Community College Board. Micah Knox is the person in charge. They're trying to put some things together for centers because they are going out as a coach to the centers. Dr. Angela Bass with the Mississippi Early Learning Association is also developed now through that group is the Shared Services Home, where there will be vendors that will be recruited so that the child care facilities can actually access funds at a much lower rate in terms, access equipment or materials at a much lower rate than if they were buying it at price on the shelves at Walmart or at Dollar General or wherever. So Angela has a mechanism. We have to try to get child care centers to know about it to sign them up. She's been having training, but one of the things that you all could do is to, if you know child care centers, if you're working with them in any capacity, make sure that they reach out to MELA, so that they can sign up for shared services. By signing up, then they will cut their expenses considerably when they have to order any of the cleaning materials. It also will allow them to order food at a discount, educational supplies. So that is would be a big help to them. It's just to make sure that they are aware that this exists. I see that Ms. Brown is saying that they are needing children's masks, and she's gotten some information there in the chat box. My personal concern about little children and masks are that they are not going to wear them, and it's going to become a bigger issue about hygiene, because I'm going to take Charlotte's mask and throw it out in the hallway because I'm just going to be funny and do it, and then there's going to be a big fuss about how do I get Charlotte's mask, and are we going to have to clean it? Is there going to be a new one? With 4-year-old children and 5-year-old children, they're children. So one concern has been, what can we do if the children are not going to wear the mask? And I have been trying to promote people to look at the what I call face shield hats. They're called fisherman hats, and that would be where the child has a little hat on, and it's not uncomfortable. They can breathe. It's fun. And some teachers may have to look at doing something like that, because if they're going to stay with a mask on 6 hours a day, I've been telling teachers they need to practice wearing the mask, because they're not used to that at this point. Sammy has asked, are there things specifically that child care advocates can be doing? Number one, contact the health department. They're going to be putting up some potential licensing changes or additions, and they have a 30-day comment period. As you read those, you'll see that they're giving choices for child care facilities to do with regard to for instance, screening children using thermometers and so forth. And I will just say this because I know we need to go. But the Kellogg Foundation has allowed us to get a digital thermometer for each child care facility. We've got 1,000 thermometers, and we're trying to make sure that every child care facility gets one. That is one thing that if everybody's temperature was taken every day, once or twice during the day, staff included, that would go a long way perhaps to mitigating the spread of the virus. So, Dave, thank you so much for letting me come on and talk. And if anybody has any other questions, if you want to put up that last slide about how to contact me. I think
great.
There's one more.
There we go. Cathy,
and so,
yeah.
No, I was just going to say, there's my email if anybody'd like to contact me. I have more ideas, but main thing is to know what your community needs. Survey your local communities first off and push on the health department. Thank you again.
Thank you, Cathy. This is incredible information and extremely important. And it's something that we're all trying to think about and problem solve, because you're right, it is a community initiative. It needs to be a community effort. So thank you very, very much. And again, if you have any other questions, please feel free to reach out to Cathy. So with that,
thank you.
Thank you. We're going to move on to another amazing presentation. And we have Terrence Johnson here with us, who is the co-owner of iProgress Counseling and Consulting, an incredible person doing incredible work. So Terrence, I'm going to turn it over to you.
Okay. Good morning to everyone. I thank Dave for the opportunity to speak with you all today. Let's see. Okay. He just shared it to me now. Okay. Let's see here. Can everybody see my screen? Okay. All right. So, what I wanted to cover is mental health and COVID-19 in the workplace, but I wanted to look at how people feel and respond to it on a more personal level. And so it's regarding the fears and concerns that people have regarding how they keep themselves safe, how they keep their family safe, how do they feel going into environments where they might be in contact with people, direct contact, and keeping themselves safe. And so we're going to cover that. I just do a brief introduction of myself. Terrence Johnson. I'm co-owner of iProgress. We're a personal development business. My background is in mental health. I've been a therapist for a number of years, and also I was a professor for a number of years as well, teaching other counseling students. So I did that a while at Mississippi College. My psychology degree and my master's degree is both from Mississippi State. I got my doctorate degree from Mississippi College. And so basically in our business, we aim to infuse purpose, invigorate minds, and ignite change in people. And so through this presentation, hopefully it'll be something that you can gain, or some kind of insight, or some kind of reflection that you can have. But also I have a resource that you can use that will be beneficial just for you, or if you want to share with other people regarding more proactive ways that can handle different things. So with that, I will go ahead and get into the presentation. So as you see in the picture, I'm a real visual person. And so the elbow bump has kind of become our norm now, where we used to be able to shake hands or hug or be a lot more cordial. Because of the environment that we're in, we have to make sure we protect ourselves. And that goes from home to the workplace to wherever we are right now. And so as we think about the workplace, it's a place where we spend a lot of our time. We spend more time in the workplace than any other place, at home or whatever other responsibility that we have. So not only do we have the stress or the responsibilities to perform in our positions, but now we also have the other layer of potentially contracting COVID-19 or becoming sick even doing the work that we do every day. Okay, let's see. All right, so my main aim for this presentation is to bring awareness to these 6 areas. So we have personal contact, family and friends, financial, discomfort, impatience, and self-care. So most people think of mental health or accessing mental health services when there's a crisis or something has happened. And so what I will talk about is some of the fears and concerns that people have, but also proactive things that you can do to deal with these certain situations and these 6 areas. At the end, I'll also provide some links of some other readings that you can look at that has a lot more resources, and also some apps that you can access that can help you as far as self-care. And so once I get to that point, then I'll definitely share those resources as well. So what are your fears and concerns? So when we first started in this new age of this pandemic, most of us were trying to figure out, well, when is everything going to get back to normal? So when we first went on lockdown, most of us, just like the gentleman here, we were kind of peeking out the windows like, when can I get outside again? When can I do the things that I used to do? And how can we hurry up and get there? But as we've come to realize now in the last couple months and even the last few weeks, the pandemic and COVID-19 is not necessarily going away anytime soon. So how do we deal with that? How do we cope with that? And also, how do we cope with that even in the midst of still going to work and trying to provide? So the first area is personal contact. So if you're in environments where you have direct contact with other people, or if you're a nonprofit, you're doing more street related work where you have people, everyday people that you're interacting with, personal contact can be one of the main areas of like anxiety, because you want to be able to still provide your service for the people that you serve, but also how do I still protect myself in the midst of that? And that can be stressful because you might always be checking, make sure you have your gloves, your mask on, or you don't adjust it. Also, you trying to wash your hands, or maybe you have gloves. And even with that, you still may not feel that you're fully protected, or you never have that full sense of being comfortable, because you're still kind of heightened with your anxiety, because you just never know, and it evolves and changes over time. And so what we at the beginning thought we could do, now we're not able to do, and now it's more and more restrictions on what we can and can't do. And so it's ever evolving. So you never really feel like you're fully doing everything you need to do, which can be difficult. Family and friends. So this picture right here, this is a father with his children. And like I said, with children, they like to be around their parents. They like to be around them, lay around them and all of that. But just to say, if this father was in an environment or a job or an environment where he was around people that could expose him to COVID-19, this very scene right here may feel very uncomfortable for him. Not that he wouldn't want to be around his kids and kind of share those moments, but it's the fear of passing something to children, or even in the sense of, children with their, maybe elderly parents or their grandparents. It's hard for us to still connect in the way that we're used to. And so we're having to connect in ways that might not feel as genuine to us, but doing it in a way that still keeps us safe. And so for a lot of people, especially people that's on the front line, they have a fear of the work that they're doing coming back home and passing it on to their friends, their family, and their loved ones. And so it's that constant thought in the back of their mind that, hey, one day I may just, something might happen and I may pass something to my kids, even though I'm taking all the precautions that I know to do. Financial. So as we know, many industries have been affected by the coronavirus. Many people have lost their jobs. Many people have gone on unemployment, and that's stress enough. And that's hit the nonprofit sector as well, where some nonprofits have had to close or had to reduce staff. But also in that reduction, the people that do still work or have employment, they may have added responsibilities, and so even that may cause adjustments to hours worked or the amount of money that they can earn versus what they used to earn. And so it's the constant fear or stress of, will I have enough to make it from day to day, for my family or for myself, or just to kind of keep my head above water. And so you add that financial stress to work stress, and that can be a very heavy and very difficult combination. So discomfort. So the previous speaker, Cathy, she kind of talked about it, about the children as well as like teachers. And that's one of the things too, even though we're protecting ourselves, wearing the mask for multiple hours and wearing gloves and all these things to protect ourselves, it may not be the most comfortable thing. And so even though we're going and doing the things that we know to do to protect ourselves, that doesn't mean that it's comfortable and that we want to maintain it all the time. And so even with that, even in our discomfort, it may put us in places to put ourselves in risk, because taking off our mask just for a little moment may cause us to contract COVID-19 or pass it to somebody else. And it's not that we're inadvertently meaning to do it. It's just the fact of, we just kind of need a break from all the protection, all the protective measure that we've been doing. So it may be, if you're going to take a break from your mask, you're doing it in an environment to where it's not in contact with other people, or you can have it more controlled, so then it won't put yourself at risk as well. So impatience. One of the things, and I just read something earlier this morning about how people's media consumption around COVID-19 is causing them to have a lot more mental health issues, a lot more stress, because we're consuming everything that's bad, that's wrong with what's going on right now, the restriction that we have. Some of us watch the news constantly all day long, and so we really don't give ourselves a chance to really have a break or to even process a lot of the things that we feel, because it's one thing after another. And most of us at the beginning, we kept saying, well, we're just waiting for things to get back to normal. Well, now we're pretty much in a new normal. And even as the cases or risk of things kind of subside, we still will have some level of protection that we need to have for ourselves to combat things, even as a vaccine becomes available. So our best way to combat it is to think about ways to do what we used to do in innovative ways. And so even with that, or those that are service providers, it may be looking at, well, how can you do some things that you used to do in a more innovative way, or using technology to push more positive things, or to showcase some things that you're doing with your organization that maybe you used to do it more in person. Now it may be on a online format. And then self-care. Most people, they enjoy self-care, and they enjoy going to work out and walking and things of that nature, but that's been limited right now. And so how does self-care look right now? Or if you're on the front lines and you're working long hours, how do you take care of yourself or if you're in a nonprofit, how do you make sure that the people that are working for you, that are employed by you, they still have some level that they can take care of themselves as well in even in the midst of them doing the work that they're doing. And so that has changed to where people can't really go to the gym. They can't really do more group things like CrossFit. A lot of people enjoy, or even classes that people used to take at different community centers and all of that. Most of that has kind of been scaled back. So how do we take care of ourselves when a lot of the things that we did had contact with other people, and now we're not able to do that? So now we kind of talk about proactive measures. And so we all know about washing hands and social distancing and avoiding touching our face and wearing a mask and disinfection and staying informed. But I've created something that can help you kind of pinpoint some things you could do in different areas. So this right here, I've provided to everybody. I've provided it to everybody as a PDF that you can edit and type into. And so with each one of the areas that I've covered, they also have the fears and concerns like we talked about, but also proactive actions. So with personal contact, you can kind of think about proactive ways that you can handle that for yourself or for your organization, even with your family and friends. I know we just came off of the July 4th weekend or the holiday, and a lot of people wanted to get together. Or even if you think that you'll be traveling to see other people, other family and friends, one of the best things to do is to at least get yourself tested, so that you know for sure that you're negative and you're not spreading the disease if you are choosing to travel. Financially, we know a lot of people have had to start working from home, or working from home has become their normal. But also, if you have lost employment, or people that's connected to your organization have lost their jobs, there are resources. But also, a lot of things can be done from home that can help supplement the income that people have lost. Discomfort, one of the things I know I've had to do it for myself, is find masks that kind of that are more comfortable for me. I know the first mask that I had, it was very uncomfortable and it didn't really fit. So I had to kind of try some things to try and find something that fit for me. Also, like Cathy was saying before, the face mask. I know that's something that a lot of people are going towards too, and so it's not necessarily tight around your face like the mask would be, and they'll still give you protection. So that might be an option for some people. As far as the impatience, it's limiting your social media use, or even what you watch on TV, and trying to kind of replace those things with more positive things that you can watch or listen to. Um, and that's something that I've had to do. I've had to kind of limit myself on how much social media I can do and how much time I spend on my phone, because that helps my well-being and self-care. And so I have some options and some apps that I'll talk about with self-care. So I'll move toward the next slide. So for those of you who are big into meditation, or for things that kind of help calm them, Insight Timer is a great app. They also have courses that you can access. They have a free version where you can get a lot of value from it, but also they have a paid version that gives you a little more. If you looking at it, looking to do the same thing from a more spiritual side, Abide does the same thing. They kind of have meditations, but they're more like Christian based. If you want to do that, All Trails is an app that allows you to locate nature trails around your area, and it kind of tells you the length of them, if they're open or closed due to COVID-19. So it's a real good app. One thing that I did find that I didn't know that they had Airbnb has online experiences that you can do. So if you're looking for something to do, even if you can't go anywhere, they have a lot of different experiences that you can do, whether it's like cooking classes or learning how to do new things, just things, listening to music, concerts. They have a lot of live musicians and things that you can access. And so if you want to do something just to kind of break the monotony of just the things that you have been doing, that's a great place to start. Most of the things are just a few dollars, like $5, $10, at the max, maybe $15. And so that's a good resource. Sanvelo is another app that kind of has a lot of the mindfulness type things, but they also have it to where you can connect to therapists if you need to. And also they can connect to your insurance as well. And so if you wanted some resources, your insurance could pay for the premium version of that app. And then Shaper, I know a lot of people, they're not able to network like they used to, or connect with other people, or connect themselves to people that might have resources. And so Shaper is a way to do that. They kind of integrate with LinkedIn. And so you can connect with people in different industries, different job titles or whatever, and build relationships and do online conferencing with them and help to network in kind of like a more online digital way. And then these are just some resources that go more in depth about some things as far as like financial things, as far as like nonprofits or from the Mississippi Department of Mental Health, what they have regarding the coronavirus right now, and different things that might be helpful. So I have all these, and I also put all these links in a Word document as well. So if you need these and if you want access to them, I can send them to Dave and have them send it out to you all. The chart that I talked about, he already has that, so he can send that as well as a resource for you. And this is our address, our website link, and our Facebook link, our phone number, and our email address if you want to connect to ask more questions. And that kind of wraps up for me. Does anybody have any questions? Any comments about anything that I covered?
Terrence, I'll tell you, you're getting a lot of love in the chat. I've gotten a lot of messages. This is incredible. I love the practical resources that you shared. It makes a big difference. It's not just all theory. It's really sort of meaningful ways that people can help themselves and others. So it's fantastic.
Okay. Thanks so much.
Because it is 10 o'clock, I'll leave it open for just one comment or question if somebody has one. Otherwise, we'll go ahead and work on wrapping up.
Okay.
Okay, so just as a reminder, we have Donna's training on Monday. Jan Eastman was in the room for a little bit. She's going to be doing a training today for the 6 jobs of every board member. Tomorrow we have part 2 of Pam Confer's training. Hey Jan, there you are. We have part 2 of Pam Confer's training, activating diversity, and a whole host of others as well. You can learn more and register at alliancems.org. Thank you, Terrence, for taking the time to be here. Thank you, Donna, for speaking. And although Cathy is not on the line anymore, we'll just go ahead and throw one out into the ether. Thank you, Cathy, for taking the time. And of course, thank all of you for making the time to be here. Please be safe, be well. And I know I will be using some of Terrence's ideas and resources this weekend. So thank you again. Y'all be well.